My name is Brendan McKenna. I'm a reporter with RTT News.
Thank you.
Leaving aside if the question of abortion were to be resolved to your satisfaction, would you then support the broader aims of the healthcare bill, of the seeking to expand coverage, the way that it's being brought about?
We would like to ensure that abortion is never paid for in any program in America, neither euthanasia. Now, there are some parts of the bill that can certainly be supported, and we're going to continue to examine those. But before we can actually answer that question, we're going to have to get abortion and euthanasia out of it. I'll see if any of my colleagues want to help to answer that. Okay?
I'd mind speaking to that.
Yes.
Yeah, Dean Nelson, kind of based on what I had shared a little bit earlier, I think, number one, that there are options currently that exist. I'm not in favor of the current health plan, particularly for the issues of abortion, but even beyond that, as I stated with you, there are faith-based options currently. The one that I actually have that I stated before, that gave me, over the course of 5 years, better coverage, and my premiums actually went down. And I think that there are people, particularly in the administration, who want to push us quickly towards a government, provided healthcare system, don't want that message to get out. And I think that it's an extremely important one. By information, I actually have a family of 5. We live here in the Washington, D.C. area, combined income of less than $60,000. So I fall into the category that we're all talking about. And I think that what we need to do is to look at these type of health savings accounts, as well as other faith-based programs like MediShare, that incentivize good behavior, particularly in the black community. And that's my question. Now, the newer option that I've heard a little bit about with regard to the co-ops, that may be a more acceptable way. I'd like to see really how that would be rolled out. But I think that as long as we look at programs that incentivize better behaviors and more responsibility for the individuals, I think that we'll have a better solution. Thank you.
Can I add one?
On the euthanasia, if I can follow up. I mean, from what I've understood from reading the bill, and a lot of the administration is pushing back, saying what we're doing is merely providing funding for a consultation so people can decide about a living will. That living will might say, keep me alive with any measure possible, kind of thing. Why use the euthanasia argument?
Death with dignity is what it's often called. But to suggest that people over a certain age every year would have to have consultation, and also in that is perhaps understanding their duty to die, to get out of the way. All of those are implied. And there again, if you have legislation that does not specifically say, we will not provide funding for euthanasia, then the interpretation can be very broad or very limited. You want to?
Well, you said it very well. I was simply going to say the details have to be put forth. We have had a team of people looking at what is actually written down in 1,000 pages, and it's slim on details. So I'm with her and follow her for those reasons.
Does anyone else have questions? Please. Go ahead, please.
Yes, Dr. King, if you would like to speak to what I think a lot of people miss about the euthanasia quote-unquote argument is the issue of rationing and what that actually means. People are focusing on these, whether or not there is actually a death panel or not. But when you get into comparative effectiveness research, which is in the bill, and you start deciding who can have, based on age and quality of life and how much longer they might have to live and how much all this costs, does that, in your mind, equal euthanasia as well?
Would you please identify your organization?
Oh, sorry, Connie here with Human Events.
Thank you, Connie. Well, there again, if things are not spelled out and clearly defined, it really doesn't matter what's in my mind as an individual, because I may interpret it in such a way that it would be very generous to the elderly. But suppose someone else has a different mindset and is allowed to interpret accordingly. And that is the problem. One of my favorite things that I say, and please forgive me, I am a Star Trek fan. The needs of the many outweigh the needs of the few or the one. And so collectively, we're going to have to take care of all of our people. That's the beloved community of Dr. Martin Luther King Jr. So it's not so important what Alveda personally thinks, But does America believe that life should have dignity from the womb till natural death? And that's where it's playing with those places. And many people that I hear, they'll say, oh, well, the word abortion is not in the bill. The word euthanasia is not in the bill, so we're okay. Well, if it's not clearly stated that euthanasia will not occur by any definition, nor abortion will not occur by any definition, it can be too broadly interpreted. And then any of us as individuals, we could perhaps say, well, my grandmother just died recently, and I would never have dreamed of euthanasia for her. And that's a wonderful thing to hear. But what about all the millions who could come under a plan that would cause them every year to have to think about the duty to die?
Peter Shinn with ProLifeNews.tv. I have a question for Dr. Harrison. As far as I think that as much as from my perspective, would hate to admit to this. I mean, this bill's going to go through one way or the other, and it probably won't with the extreme provisions that the pro-life community doesn't like, but it's going to go through and it's going to affect physicians around the country. And the physicians are then going to have to make moral decisions, and how are they going to be protected from that, and what will your organization do to protect themselves from being put in a position where they might have to agree to certain circumstances that they won't agree to?
Okay, that's a big question, so let me break it up. There's no doubt that we need to have health care for everybody in the country. There's no doubt. We need a new system. But the system can't come at the price of killing our children and killing our old people. That's not the way to bring in health care. That's not the godly thing to do. That's not the life-giving thing to do for our community. The physicians that are involved both with the American Association of Pro-Life Obstetricians and Gynecologists and Christian Medical Dental Society and Catholic Medical Organization were polled as to what they would do if they were put into a situation where they were forced to either euthanize a patient or abort them or lose their job. And they said 89% of them will quit. And that is taking out the physicians who are in the Catholic healthcare system, 1/6 of the healthcare in the country. That is taking out the physicians that are in rural areas. Most of the physicians a majority of the physicians in our group are in underserved areas. So we're going to take away the care from the most needy people, not just the unborn and the elderly, but the most needy people by forcing ethical physicians who have taken the Hippocratic Oath and will not violate that oath. They will not kill their patients. We're going to take them out of the healthcare system. And what are we going to be left with? The bill that we have now is not the way to fix the healthcare problem.
Wow.
Thank you.
That needs to be heard.
Okay, well, thank you very much for coming. We're very glad to see you today. Goodbye.